We don't really know who the ideal donor and what the ideal poop looks like. We know that more is better, and 50 grams is our cutoff. It's hard to know when you're donating stool what 50 grams is. And so what I tell people is I need you to visualize 2 king-size Snickers bars. I don't want Tootsie Rolls. I don't want Hershey's Kisses. I need 2 large, extra large, king-size bars. And then what I do is I say put them into a Tupperware container, some airtight container, put them in the refrigerator, bring them in. They should be fresh, meaning having had a poop within 8 hours of the procedure. I take that and I weigh it first, just by itself, to see how much it weighs. Then I put in some saline solution to make it more into a slurry and kind of almost like a smoothie consistency, and put an airtight lid on top of it, and then shake it up really well to get the nice smooth consistency, or as smooth as possible. We take 2 wooden sticks to help with that, and I mouth breathe the entire time because, you know, it's stinky. And then pour it over the gauze to filter out all the fibrous stuff like the corn and seeds, because they clog up the syringe and the colonoscope. And we do that twice to get that silky kind of consistency of the donor poop. We generally use anywhere between 5 and 6 syringes, and they're full of about 60 mLs or 60 cc's of liquid poop. So a total of anywhere between 300 and 360 milliliters. I just bring it to the patient's room. We get the patient ready for a colonoscopy. They get medications, they get sleepy, they're sleeping uncomfortable. I insert the colonoscope all the way to the end of the colon, and then I uncover the poop syringes, and I have a hole that I put the syringes through. They all go right into either the end of the small intestine or the first part of the colon, and then the procedure is done. So I'm a gastroenterologist, so doing colonoscopy is what we do, and I treat diarrhea. That's also what we do. Having a 90% cure rate is kind of unheard of for almost anything. And again, the people that we see who have this disease have had it for a long time, and they're kind of at wit's end. And so it's the most gratifying work that I do. They are the most grateful patients that we see because they have just been suffering for so long. And that's why I do it.